Urinary incontinence, the involuntary loss of urine, affects a large number of women at some point in their life. Women who are pregnant or have recently had a baby are particularly at risk, and many will leak urine on occasions. Leakage is most likely to occur when they cough, sneeze, laugh, or exert themselves. For example, lifting something heavy, getting up from sitting on the ground, or running, known as stress urinary incontinence. Although less common, leakage might happen when a woman needs to pass urine. She may get a sudden urge and leak before she reaches a convenient place to empty her bladder, known as urgency urinary incontinence. In addition to the leakage, she may feel the urge to pass urine more often than normal and therefore need to empty her bladder more frequently. Some women will experience a combination of all of these symptoms. Although symptoms in pregnancy may cease after the birth of the baby, this is not always the case. Approximately 1 in 3 women will leak urine in the first few months after childbirth, even if they had no problem in pregnancy, and some women's symptoms persist long term. Women can reduce the risk of leaking in pregnancy and after they've given birth if they practice pelvic floor muscle exercises. If they're already leaking, these exercises may reduce or stop this. The position of the pelvic floor muscles is shown on this diagram, which represents a side view of a woman's pelvis and pelvic contents. The muscles extend from the pubic bone at the front, the right side of this picture, through to the very bottom of the spine, the coccyx, at the back, on the left side of the picture. You can see how the muscles support the bladder, uterus, and lower bowel, and they contribute considerably to both bladder and bowel control. The muscles also play a part in comfort during sexual intercourse. The female pelvis is designed for childbirth, but there can be problems in some cases for a number of different reasons. The pelvic floor lies in layers in this area. There's not only muscle, but also connective tissue, fascia, which is influenced by pregnancy and which can be damaged during childbirth, as can the muscle and its nerve supply. Some healthcare professionals question the wisdom of exercising the pelvic floor muscles during pregnancy, in case stronger muscles might make a vaginal birth more difficult. This has never been shown in research studies. Well-exercised muscles may be well-toned, strong, and will work well, but they can also relax. If anything, women who've exercised will be more aware of their muscles, which might even help during the second stage of labour and childbirth. Pelvic floor muscle exercises can be undertaken in any position, lying, sitting, or standing. It's very important that women know how to exercise their pelvic floor muscles correctly because it's easy to get it wrong. This is because of the position of the muscles, which can't be seen from the outside, so clear instructions are essential. The urethra, the woman's bladder passage, passes through the muscles, as does the anal canal. So, to locate the correct muscles, a woman can be asked to imagine that she's holding in gas or trying to stop the flow as she passes urine. The feeling should be that of a squeeze and a lift up and forward in the area between her legs where the muscles lie. She should keep other muscles, such as her buttocks and thighs, relaxed, although she might draw in her lower abdomen gently, as these muscles can work alongside the pelvic floor. Women should learn to do their exercises without holding their breath, and one way round this is to ask them to count at the same time. It helps the woman estimate how long she can hold a contraction before letting go. After each squeeze, the woman should relax the muscles fully for at least 4 seconds before contracting again. The only way to be sure that the correct muscles are being worked is for a suitable skilled health worker to observe or palpate the area, if indeed this is practical and appropriate and the woman gives informed consent. If the perineum can be observed and the woman correctly tightens her pelvic floor muscles, the examiner will commonly see some pulling in of the anus, movement of the perineum body upwards away from the observer, and possibly a lift of the back wall of the vagina. She should not be pushing downwards. A digital vaginal examination is recommended in many countries before pelvic floor muscle exercises are taught. However, this is normally carried out by a healthcare professional who's undertaken specific training, so may not be appropriate in many situations. Once a woman knows how to tighten her pelvic floor muscles correctly, she'll benefit from advice on how often to exercise, how many exercises, and so on. Opinions vary about this, but evidence-based guidelines suggest that pelvic floor muscle exercises for women with urinary incontinence are practiced 3 times a day. On each occasion, the woman should contract and relax her muscles at least 8 times. In practice, this regime might be varied, as women with very weak muscles might only manage a few very short squeezes, and a woman with stronger muscles might manage more than 8 long squeezes. To strengthen their muscles, women should be encouraged to carry out the exercises on each occasion until their muscles start to tire. They'll hopefully be able to feel that their squeezes are getting weaker or shorter, so will know when to stop. As they practice the exercises each day, they'll notice that gradually they can do more contractions and hold each one for longer. Women should be advised that progress may be slow. It can take 4 months or longer to strengthen the muscles significantly. If women are leaking urine with coughs, sneezes, and physical activities, it may also help to practice some fast contractions. Squeeze and lift up hard and fast, then let go completely, and repeat up to 10 times. In addition to doing the exercises regularly, ideally 3 times a day, women should be encouraged to use the muscles when they need them. For example, squeezing and lifting before coughs, sneezes, laughing, changes of position, heavy lifting, and keeping the muscles contracted throughout. This will minimize or even stop leakage. Women who experience a sudden urge to pass urine can also tighten their muscles at that time. It may reduce or stop the urgency and allow her to reach a convenient place to pass urine without leaking. Pelvic floor muscle exercises are quite convenient. They can be done in any position, and no one else can see what the woman is doing. However, it's easy to forget to do them, so women should be encouraged to associate them with another activity, such as washing, drinking, or cooking. In summary, problems with bladder control are quite common during pregnancy and after childbirth. Ideally, all pregnant women should be taught carefully how to exercise their pelvic floor muscles and encouraged to practice them throughout pregnancy. Women should be encouraged to do pelvic floor muscle exercises after they've given birth, even if they didn't do them during pregnancy. They can start as soon as they feel comfortable. These exercises are likely to reduce or stop any symptoms. They should be carried out 3 times a day, about 8 contractions each time. If women can contract their pelvic floor muscles on the occasions that they normally leak, for example, coughs, sneezes, changes of position, and physical effort, they're likely to leak less or not at all. It takes time to improve muscle strength and function, so women should persevere if they do not see any results immediately.